I'd also like to acknowledge the traditional owners of the land. I'd like to welcome the distinguished guests to the conference, and I would also like to offer condolences to the colleagues who were caught up in the tragedy of MH17 travelling to the conference. Is the presentation going to come up? That's all right. Thank you. Today I'll be speaking about integrating HIV, tuberculosis and malaria programs at our Lihir Island gold mine in Papua New Guinea as part of an integrated community health program. Newcrest mining has an Asia-Pacific focus. We have operations in Australia, but a number of operations offshore as well, where malaria, tuberculosis and HIV are key challenges for our community health programs. At Lihir Island in Papua New Guinea, we have a community health strategy that the mine facilitates, but is developed in consultation with local level government, with community representatives and also the local landowners. And there's a number of challenges and learnings that we have from operating those programs. Just to quickly outline the asset portfolio and the challenges that we have in the different regions where we operate. Outside of Australia, our operations and projects are often in remote locations where there isn't good access to medical services. We're often surrounded by village communities, so the role that we play in helping to support those communities is vital to our vision as miner of choice. The regions where we operate are exposed to a variety of different health aspects. I'll speak a little bit more now about Lihir Island. So at the gold mine on Lihir Island, there's a population of about 26,000 people in the island group. Malaria, tuberculosis and HIV are all present there. Newcrest employs around 4,000 people from these local communities. We also have fly-in, fly-out people that come and work at the island. So approximately 90% of the people that work at the mine are Papua New Guineans and 30% from the local community at Lihir. So the health program that we offer at Lihir, we offer a program of services that is contracted through International SOS. There's a large hospital there on the island which provides community health services. The public health program was established in 1998 and a community health committee called an in-hog committee helps to oversee those community health programs. So we're not just providing services for our employees, but also for the broader island group. The programs that we're currently focused on include malaria control, so that's vector control out in the villages, also prevention and anti-malarial chemoprophylaxis. The tuberculosis control program, and we're starting to see emergence of resistant strains of tuberculosis, which is a challenge for us in the regions where we operate, and a HIV/AIDS control program as well. There's also been studies on the island around neglected tropical disease elimination projects. So diseases like yours, which can be debilitating for the local community, so we're progressing studies and research in those areas as well. For our employees, we offer annual medicals and as part of the services that we offer to employees, also voluntary screening for HIV and counselling services, all completely confidential for the employees. The medical facilities and services that we provide are at very low cost for the local community. So there is a token cost through the local landowner group, but it's largely subsidised by the company, which is a challenge for us going forwards in terms of at end of mine life, maintaining that positive legacy. So that's something that we have to work with the local level government and the national government to make sure that that continues. So HIV forms part of an integrated approach at Lihir Island. So the Lihir Medical Centre is registered and accredited to source the free fixed drug combination, TB drugs and anti-retroviral treatment from the Papua New Guinea Government. The HIV program includes improved detection by training primary care workers to supervise HIV awareness and help to educate people about HIV. We also have education programs through local high schools and with the local community. The HIV program at Lihir has seen a steady increase of voluntary HIV testing, which is very positive and pleasing for us. Approximately 80% of employees now have gone through voluntary testing, and 82% of patients diagnosed with tuberculosis have also volunteered for testing. And we've seen those numbers increasing. I'll show a slide shortly just to show how that's increased. And 86% of pregnant women who deliver in the hospital in 2012. Rob touched on the challenges, particularly for infants with HIV, so we encourage pregnant women also to get tested as well. This slide just shows, since 2006, some of the trends that we've seen in testing. The red line shows the proportion of employees and pregnant women tested. So since 2006, 2007, as our education programs kicked in with the local community and with working in partnership with the local level government, there was much greater awareness of the services that were offered, leading to a higher percentage of people being tested. During that time, we've also seen a decrease in the number of cases. There's been programs around distribution of condoms and awareness, so lots of work going on through local church groups, through government groups, educating people. So we believe that decrease in the numbers that we're seeing is associated with the success of those programs. We now need to continue those trends. So some of the key challenges and learnings. Malaria and tuberculosis are significant challenges for us, and HIV forms a key component of that community health program. There's significant health challenges to our workforce and also to the local community, where we source a large percentage of our employees from the local community and from within PNG. So it is, in terms of sustainability, it's very important to us to continue these community health programs. One of the challenges that we have is around improving the acceptance that the local community and our employees have for testing. We've seen the testing numbers increase, particularly within the workforce related to education, but within the broader community, there's still a little bit of reluctance to go and be tested. News travels very quickly within the local community, and it can be hard to maintain that confidentiality, which we try to do as much as possible. So there is still some reluctance to go and get tested. Across the island group, it's still very hard to get accurate statistics on all of the villages outside of the immediate mine area. So we're working with the local government on ways that we can get better statistics and understand what are the key performance indicators we should be tracking. And there's opportunities for better integration with the local communities, with the local level government and with the landowners, taking these programs forward and making them sustainable beyond the life of mine. We see that as one of the key challenges. Thank you.